Hi everyone, my name is Mark. I'm a mental health therapist and welcome back to my mental health video series. Today we're going to be talking about a very common mental health issue, something that affects a lot of people, and that issue is anxiety. So anxiety is something that can be severe enough to be diagnosed by a psychiatrist or doctor. The condition is known as generalized anxiety disorder, but you don't have to be diagnosed with that in order to be impacted by symptoms of anxiety. Some of the symptoms of anxiety include constant worry that's so severe that it causes problems in your everyday life and you have trouble thinking about anything other than what you're worried about. That worry can include thoughts about the past and things that have happened in the past, or that worry could be constantly worried about what's going to happen in the future. So much so that you find it difficult to focus on just today and what needs to happen today. Some other symptoms of anxiety include being really afraid of making even the most minor mistake, constantly thinking about all the bad things that could happen when you're faced with a decision. There are some physical symptoms of anxiety too, such as getting dizzy or breathing really fast and shallow, having a racing heart and tense muscles without doing something like exercise or an activity that would normally result in those types of body symptoms. Anxiety also can come with a lot of aches and pains, headaches and stomach aches, muscle aches, without any explanation or medical reason for them. Anxiety can also cause difficulty sleeping, difficulty eating because of how much you worry. Many people with anxiety talk about having a constant feeling of nausea, which contributes to them not being able to eat. And it could also affect your mood. You might find that you get irritated really easily, or you have very sudden mood swings, or you have difficulty concentrating and focusing on things. These are all common symptoms of anxiety. Anxiety can be long-term and persistent. Some people deal with anxiety for years, or it could be something that's occurring just right now based on your circumstances that may eventually go away when your circumstances change. Anxiety can also be linked to traumatic experiences you may have had in your life, things from your past, and sometimes these symptoms may only occur when you get triggered by these memories of the things that have happened. Regardless, anxiety is always very impactful to your everyday life, makes it difficult to live life the way you want to, makes it difficult to enjoy things, maybe even difficult to go outside, just step outside for any reason. So anxiety at its really basic level is the feeling that something is dangerous when it actually isn't. And it triggers your body's flight or fight response in response to whatever you think is dangerous. And it's a really, really common coping tool for people who suffer from anxiety to avoid whatever the thing is that creates anxiety for them, or the multiple things. The problem with avoiding is that it trains your brain to actually think of that thing as dangerous, and it just reinforces this idea when that thing isn't actually very dangerous. So we call this the avoidance cycle or the anxiety cycle. Basically how this works, and I'm going to throw up a picture here to help explain this. You perceive something as dangerous or a threat, and then you avoid it because we don't like the feeling of anxiety, so we want to avoid it so we don't feel that way. We get temporary relief because now we are not around that triggering thing, but our anxiety grows because our brain now learns, is like, oh, you avoided that danger, so that thing must actually have been dangerous for real. And then your anxiety will trigger even stronger the next time. And then we go through this cycle and it reinforces it, and then it's stronger the next time. And the more times you go through this cycle, the stronger your anxiety is going to get from that trigger. And the harder it is to break it. So what we really want to do is try to prevent this avoidance cycle. So if we think that we have anxiety, what are some of the things we can do? The first one would be to talk to your doctor. Talk to your doctor about the things you've been feeling, the things you've been thinking, what's going on with your body, and they might be able to give you a prescription for some medication. Medication can help lessen how severe your anxiety symptoms are, make your heart rate a little bit lower, or prevent you from having a panic attack. And medication can sometimes help, and in other times medication is not the right thing for people. But one of the first steps you can do is just to talk to your doctor. Another thing you can do is to go to therapy. In therapy, you can learn lots of different coping tools to deal with your anxiety symptoms. Coping tools such as breathing exercises, meditation, mindfulness, counting exercises. All of these things can help refocus your brain and to get your body down from its fight or flight response. On YouTube, there are thousands of different meditation and mindfulness videos, so you could even start there to see what might work for you. The other part of that too is in therapy you can talk about and deal with trauma. That is a much longer term process. It takes time and a lot of work. But if you want to deal with the cause of your anxiety rather than just the symptoms, exploring trauma might be something that would benefit you. Lastly, there's a specific type of practice therapy to deal with anxiety symptoms called gradual exposure. Gradual exposure is basically, with the help of a therapist or a mental health professional, making you face some of your anxiety triggers and then helping you through your coping tools when you face that trigger. This is basically a process whereby you teach your brain that the thing that it feels like is dangerous is not actually dangerous. And you're basically reteaching it how to view that thing. This can be really helpful, and this is especially helpful in dealing with the avoidance cycle. But you have to be in a place where you're willing to face those triggers and to actually purposely make yourself feel anxiety so you can treat it and deal with it. All right, everybody, that's all from me today. Thank you so much for watching my video. I hope you learned something, and we will see you next time. Bye.